Hello everyone, so welcome back. My name is Anita and today we will be talking about the implementation station under the midwifery Osce. If you have been watching my previous videos, you realize that we have been talking about the assessment station, the planning, and also a step-by-step tutorial on how to fill the meow chart in order for you to pass your assessment station. Stay tuned and stay glued to your seats. So under the implementation station, you have 15 minutes to complete the station, and all includes all required documentation whatsoever. So you have 15 minutes, and remember, which other station do we require 15 minutes of your time? That is the planning station. So assessment station is 20 minutes, planning 15, implementation is also 15 minutes. You are required to use different pen in this particular station. If your assessment station is a black pen, your implementation station is going to be a green pen, and your planning station is going to be a red pen. Not specifically with these colors, but just to let you know that each has their own color pen you are going to use to show honesty and fairness throughout the whole process. As I mentioned earlier on in the previous videos, that all documents used in assessment and planning station will be given back to you to complete your implementation station. And this is because you are going to still talk about the same patient you have been using from your assessment station. So what does this implementation station entails? This has got to do with more of drug administration, and that could be intramuscular, intravenous, subcutaneous, or oral drugs. So I'm going to show you how the whole scenario and how an implementation scenario sheet of paper looks like. With the implementation station, you are given a specific time where you are going to implement all those planning. That is your drug administration. So for instance, you are given a different scenario talking about the same patient, whereby different information is added to it in order for you to complete your implementation station. For example, you are going to administer drugs. So they will tell you that administer all 1400 medication, or administer all 10 a.m. medication. When you look at the screen, you will see a scenario of how the implementation scenario looks like, and we are going to go through each step by step. I'm going to start how you are going to approach the whole scenario, and how you are going to hold your paper, how you're going to administer your drug medication in words, as I may not have the drugs to show you. So I'm gonna use the NMC mock examination or mock Osce material to teach you this implementation station. So I'm giving credit to NMC. This video is just there to teach you how to go about each of the steps and what is expected of you when approaching a patient in the implementation station. These are the 3 things you need to take into consideration. The first thing is you approach the scene for safety. You check if the scene is safe. You perform your hand hygiene, and you introduce yourself. Never forget this. So you are given 15 minutes. 15 minutes, the clock sets, and the examiner is gonna ask you if you are ready to start. If you say you are ready to start, you are gonna approach the whole thing. The first 3 things you need to keep in mind is to check scene for safety, is to provide privacy, and also perform hand hygiene. So like I said, you in the assessment station, you always verbalize everything. So I will give an example. I'm approaching the scene for safety. I can see the scene is safe to approach, or I'm approaching the scene for safety. I can see the call bell is on the floor, which is not safe. I pick it up and put it closer to patient bedside. So I'm approaching the scene is safe to approach. I provide privacy, and perform my hand hygiene. So ways of providing privacy, it could be that you are drawing the curtain or you are closing windows. Now you need to verbalize all these things so that the examiner will give you the chance to say that, okay, do not close the curtains, but assume you have closed the curtains, because she's going to watch you perform all those processes. Or she's going to say that, okay, assume you have closed the windows, now go on. But if you do not verbalize what you are saying, the examiner may not know that this and that is what you meant. So always verbalize what you want to do. So if you are taking the cowbell from the floor as you are providing safety, say it. When performing your hand hygiene, always verbalize it. Performing hand hygiene, palm to back, fingers interlock. Say all those words out loud to the examiner to know that yes, this is how you are performing your hand hygiene. After, you leave it to air dry for 15 minutes. Then you approach your patient. When approaching your patient, you need to introduce yourself first. I am Anita, the midwife taking care of you today, and today I am going to administer your 2 o'clock medication or your 1400 medication. Usually I always say the number written on my scenario. So if it's 1400, I will always say 1400 medication. I wouldn't say 2 p.m. medication. I will always give it to them as I see it, although I know what 1400 means, which is 2 p.m. You introduce yourself. You ask the patient to introduce herself back to you. So she's going to introduce herself by instructing her to mention her full name, how she would like to be called, and her date of birth. So if she mentions all these, sometimes their hospital numbers, they may not have it in mind. So if you see them with a white wristband, just tell them you would like to approach them and cross-check the details. If she says yes, that is the examiner, because that is a dummy. A dummy cannot respond yes. So the examiner will act as the patient by responding to all your questions. So don't think that the examiner is gonna trick you or whatsoever. The questions you ask your patient is what the examiner will respond you with. So don't think that the examiner is also going to help you by going to know. It's your question is what the examiner is going to answer to you. So the examiner, yes, you can approach. Then you always, before you touch your patient, make sure you have seek permission. So are you happy for me to cross-check your details on your wristband? So you check Juliana Mensah, hospital number 803999, date of birth 15th June 1994. I can confirm that I have the right patient. So Juliana, I am here to administer your 1400 medication. Are you happy for me to start? Juliana will respond yes. Then you continue. So she asks you, she tells you that yes, you are ready to start. What are you supposed to do next? Ask of allergy. You can't administer medication without asking of allergy. So you ask patients, hello Juliana, are you allergic to anything you may know of? Or do you have any known allergy or sensitivities? She will respond yes or no. If she has any allergy, she will verbalize it out to you. So probably allergic to penicillin, or allergic to codeine, or allergic to latex. So a patient who's allergic to latex, you need to make sure that whatever gloves you are using is not made of latex. So latex free gloves is what you approach your patient with, and you need to let them know that you are using a latex free gloves. If your patient tells you all her allergies and patient has no red band allergy band, always make sure that you have gotten an allergy band on patient before you are continuing to administer the medication. And also inform the patient that once he or she is here, you are going to make sure that patient is not administered with any drug whatsoever containing her allergies. After your patient has consented for you to administer her 1400 medication, you need to perform your hand hygiene all over again and verbalize it. As I said, hand to hand, palm to palm, all those and blah blah blah. Then you now go to your sheets. Go to the first page of your sheet as it is showing on your screen. When you look at the middle right corner, you can see that from number 1 to number 9, it has details of each point and its own details. Now, the reason it being that if a particular medication is not administered, always document on the last page of the drug chart using this code. So this is called a code. As some people will go by, therefore I'm going to use code 2, which means that omitted for a clinical reason. So these are the codes. So you always write a particular code, and that shows that this is what qualifies for why you are not administering the drug. After you are done, you move on to the next page of your drug sheet as shown on your screen. You will see that they have prescription chart for the name is going to be there, the sex, hospital number, date of birth, admission date and time. As you look through those processes, we have once only and start doses, we have prescribed oxygen therapy, we have as required medication, that is PRN drugs. Always keep in mind that you need to always voice these out to the examiner. For example, you are voicing this out to the examiner and the patient. So once only start dose, simply recite what you see on the sheet for them using the 5 R's. So once only start dose, date today, time due 1400, drug name anti-D, dose 500 IU, route IM, prescriber's signature Dr. Z Gupta, prescriber's bleep 505, given by, checked by, and time given. If you look at this, we can confidently say that this qualifies for a 1400 medication. Why? Because all the details there shows that we are having the 5 R's, that is the right date and time, right drug, right dose, right route, and the right prescriber's signature. So yes, you therefore tell the examiner, I am happy to administer this drug, and this is an intramuscular medication. What I usually do is that I do not go to administer the drug. I always voice out all those things I do and put a tiny indication like a full stop there, just to show that yes, after I have voiced all these drug charts to my patient and the examiner, I am going to prepare my drug and administer them. So I do not go back and prepare the drug and come to give it to my patient before moving on to the next. And this is the reason. This is for infection prevention, because anytime you move away from the patient to prepare your drug, you need to perform your hand hygiene and your safety precaution. Administering a particular drug also comes with its own infection prevention procedures. So going to and fro can delay your 15 minutes. So always list the things you are happy to administer, and now go back to your drug cupboard, prepare all those drugs you are supposed to give to your patient, verbalize those drugs again, and simply give all to your patient. Then at least you know that you have saved time with respect to infection prevention process. The next step is prescribe oxygen therapy. You voice it out, prescribe oxygen therapy. However, I do not find any oxygen therapy you need to be administered on. Therefore, I do not give oxygen therapy to you. We have as required medication, that is PRN drug, date today drug paracetamol, dose 1 gram, route per oral, and instruction is 4 to 6 hourly. Prescriber's signature and bleep is Dr. Z Gupta 505. A prescribed PRN medication is given as required. As required means that is when patient needs it. For example, your patient has mentioned in the assessment station that she was having headache, or probably she was in pain. You graded the pain probably 1/3 or 2/3 or 3/3. Therefore, your patient said that she needed a pain relief. If you watch my assessment video, I did tell you that anytime a patient tells you that she is in pain, grade it and ask the patient if she will require a pain relief. If she says yes, tell the patient that right after your assessment station, you are going to inform the doctors to review her and prescribe her with the right analgesics. So here comes the PRN drug, which is analgesics. You ask your patient, when was the last time you had any pain relief? Probably the patient will tell you that I had it at 12 p.m. Now 12 p.m. to 2 p.m. is 2 hours difference. Here lies the case. The medication is supposed to be administered between 4 to 6 hourly. What are you supposed to do then? You need to make sure that you tell your patient, I am not happy to give you this particular drug as it is not due yet. Therefore, you can ask your patient, will she require any different kind of pain relief? If she says yes, be happy to inform the patient that you are going to inform the doctors to review her and prescribe her with a different pain relief. That saves you. Therefore, you are not supposed to administer the drug. And why are you not supposed to administer the drug? You go back to the codes on the first sheet of the medication chart. Check which of them tallies with it. If it's for clinical reasons or if patient is not due for the chart, check the codes and write the particular code there. However, if your patient had taken the medication probably around 8 a.m. or around 10 a.m., the difference is now 4 to 6 hourly difference. So you are happy to give this particular medication. Indicate the time you gave it, which is 1400, and indicate your signature and your printing name. I always print my name and I sign alongside with it just to save me. Anytime you open a new page to read out all those medications a patient is supposed to take, always confirm the name written on top there. So you write, as we can see on our screen, prescription chart for Anita or prescription chart for Juliana Mensah, date of birth 15 June 1994, hospital number F03999. Therefore, I am happy that this is the right patient drug chart. You move on to antimicrobials. Date is today, dose nothing, prescription frequency nothing, and even with the drug there is no indication there. So therefore, I can confidently say that patient is not prescribed with any antimicrobials. You move on to 2. We have drug, and this drug has nothing over there, so you move on to the next. Alongside, there is nothing under antimicrobials, so you are happy to tell the patient alongside the examiner that there is no medication prescribed for you under antimicrobials. So you move on to the next page. You check the topmost part, prescription chart for Juliana Mensah, female, hospital number F03299, date of birth 15 June 1994. I can confidently confirm that I have the right drug chart for Juliana Mensah. You move on to regular medications. Regular medications, we have 3 regular medications. The number 1 is ferrous sulfate, date today, dose 200, frequency twice daily, route orally, duration 2 weeks, time 8 o'clock today, tomorrow. And when you look down, we can see prescriber signature Dr. Z Gapta. So we can confirm that we have the right prescriber. We can also confirm we have the right date, we have the right dose, we have the right route. Now let's come to the right time. We can see 0800 and 1800. The question is, are we which drug are we supposed to administer? What time? And that is 1400 drug. Therefore, can we see 1400 there? No. What are you supposed to write? That means that under the 80800, the time has passed. 1800, the time is not due. So you cannot go and write under 1800 because the time is not even due for you to administer the drug. However, the very first one is 0800, and that is the one you are supposed to write under. So 0800, you cannot give that drug. So put the code. When we visit the code on our first sheet showing the number 1 to 9 drug code, which of them goes for which of them goes for ferrous sulfate? We can say that patient not on ward. Why do I choose code number 1, patient not on ward? If you check patient admission date and time, it was 10:30 a.m. Now the drug over there is 0800. That means the patient was not on the ward as at the time this particular medication was supposed to be given. Therefore, I write patient not on ward, or I'll write code 1, patient not on ward, and sign against it. We flip over the next page and we see the prescription chart for Juliana Mensah female, hospital number F032999, date of birth 15 June 1994, admission date and time 10:30. Therefore, I am happy that I have the right drug chart for Juliana Mensah. Which drug are we going to? We have drug 4. There is no indication, so there is no need for us to even continue with it. We move on to intravenous fluid. There is no prescription for intravenous fluid. Therefore, I am not going to give you any intravenous fluid. And now we have drugs not administered. So you go back and write all the drugs you will not be given. And which one is that? Ferrous sulfate is a drug you will not be given. So you write the date, time, drug is ferrous sulfate, reason, as patient not on ward. Then you sign and you print your name. As I mentioned, anytime they say print name, write your name in capital letters. That shows that you are printing name. So the drugs we will be administering after verbalizing all these drug charts out to the patient is paracetamol. Patient has not had it before, or patient had it 4 hours before you are asking her of the medication. And we are also going to administer anti-D, that is an IM drug. Now you inform your patient that you are going to prepare the drug and come back. You go to your drug cupboard. You perform your hand hygiene before you touch the drug. Stand in front of the examiner. Look for the drug. For example, anti-D. You check the drug, check the date, check the batch number, check if the expiring date is correct. If expiration date is 04/2023, you tell the examiner, I have anti-D in my hand. The expiration date is 04/2023, batch number 222222. I can confirm that I have the right medication. Withdraw your 1500 and administer your IM. You need to make sure that once you are administering an intramuscular, you need to use the ANTT technique. What is ANTT? Aseptic non-touch technique. That is the technique you use to administer an IM drug. Prepare the medication down using an ANTT technique, and the other medication, if it's oral, pick your paracetamol, check the expiration date, read it out to the examiner, and confirm that you have the right medication at the right expiration date. You go and you perform your hand hygiene again. Approach your patient, ask your patient to confirm her name once more, and the patient will do that. Juliana Mensah, hospital number F03999, date of birth 15 June 1994. I can confirm that I have the right patient. Ask of allergy, what are you allergic to? Then the patient will tell you her allergies. If patient is not having allergies, she will tell you that she has no allergies. You now say that, Juliana, I have your anti-D over here. Give the indication for anti-D, give the contraindication for anti-D, and give the side effect for anti-D. If you do not know this, do not be shaken. Go back. They will always orientate you that you have your BNF chart here. It's either on a digital screen, or it's either on a tablet, that's a digital screen, or it's going to be a BNF dictionary book over there. Either which, tell her that you are going to confirm the drug using your BNF. That saves you, and that shows that you are honest and you do not want to give false information to your patient. You will check BNF and you will look for anti-D. Give the indication, the contraindication, and side effects. Then you will tell the patient that these are the 3 things I want you to look at. Should you have any adverse reaction or any of these signs, there is your call bell. Ring it and I will come to you. When you are administering your paracetamol, always check the BNF for side effect. Even if you know the side effect, I will be happy to tell you that always make sure you visit your BNF, read it out to the patient and the examiner. That is why the BNF is always there. Do not think that you have everything in mind, so you are going to just say whatever. If you say it, yet that is not what is in the BNF, or there is even an update, you are going to be in trouble. That means that you've said something which is not there, and that can cause you to fail your implementation station. Always visit your BNF and give the contraindications, indication, and side effect to your patient. Once you have administered your drug, you ask patient if patient is all right. You put patient in a comfortable position. Always inform your patient that she has got the call bell and to call you whenever you need her. And also perform your hand hygiene. Dispose all your PPEs in the disposable bin. Disposable bin, you have the infectious bin and you have the general waste. Never dispose a PPE in a general waste. Always dispose your PPEs, that is your gloves and your apron, in the infectious waste. Then you perform your hand hygiene. You go through your documentation, make sure that you have documented everything on your drug chart, and you can tell your examiner you are done with your implementation stage. If you are not done and you want to use the time to go through whatever, you have all the time left once your 15 minutes is not yet up. I hope you all enjoyed this video. This is very quick and very cumbersome, but I am happy to show you all these things, as it is going to help you. If you haven't seen a drug chart for Osce, it looks scary, but once you've watched this video, I hope you've understood everything under the implementation station. Stay tuned and go nowhere, as the next video we will be talking about the evaluation station, and that is the last of the 4 link station called the Apie, considering that same particular patient. Thank you and enjoy the rest of your day.